What's up, guys? Still on our thorax anatomy and also respiratory physiology. You know that once you are touching thorax anatomy, you'll be touching respiratory physiology. So today we'll be talking about mechanism of breathing. Okay, we'll be talking about mechanism of breathing, and this is actually from a scenario in the hospital. Okay, so we said that as part of your responsibilities as a house officer after graduating from the medical school, you are asked to give a concise report on the mechanism of breathing. Okay, so how do you go about this report? If your how do they call it? Um, all those higher medical personnel in the hospital, if they ask you to give a concise report on the mechanism of breathing, how do you go about it? So this is basically under inspiration, that's taking in of air, and expiration, that's exhaling air. Okay, so you talk about the changes in the thoracic cavity and the changes in the ribs when you are inhaling air and when you are expiring air. Okay, so mechanism of breathing and joint rib movement. Okay, so the movement of the thoracic wall and the diaphragm during inspiration, that's taking air, breathing in air, produces increase in all the three diameters of the thorax, thereby increasing the intrathoracic volume. Okay, so the middle of the shaft of the ribs lie at a lower level than the plane passings between the two ends. Okay, so if you keep a rib, the plane passing between the two ends, the middle of the rib will actually lie lower than the plane passing through the two ends. Okay, so that's what they mean here. That's mean the ribs are depressed. Okay, not really depressed. Okay, that's like that's elevation. Okay, so therefore during elevation of ribs, the shaft also moves what outwards. Okay, thus increasing the transverse diameter of the thorax. Okay, so this is inspiration, guys, and this is what they mean by that explanation. And you could see that the middle of these ribs lie lower than the angle passing between the two ends of the ribs. Okay, so uh, there will be elevation when you like breathe in. Okay, so there's elevation of the ribs. So this is called what? Bucket handle movement. Because the ribs uh, rotate along or about the axis that pass through the anterior and posterior extremities of the ribs. Okay, so it is like lifting up a falling bucket handle from the side of the bucket. Okay, so it's like you are lifting up a bucket handle. That's why they call it bucket handle. This is air flows in, inspiration, air flows out. It's basically what we are trying to talk about here. So, since the anterior end of the rib is lower than the posterior end, during elevation of the rib, the anterior ends also moves forward, okay, resulting in increase of the anterior-posterior diameter of the thorax. That's the diameter from the anterior to the posterior. It will be increased, okay, because you are inhaling air, your chest cavity is becoming larger. Okay, so the second to the sixth rib move up and downward. Okay, so this is called what? Jump handle movement, and this is due to the up and down movement of the sternum. Okay, so we have bucket handle movement, we have jump handle movement. Okay, guys, um, this is basically the mechanism of breathing in. Okay, basically breathing in. Okay, mechanism of breathing in. All right, and we have the bucket handle movement, and we also have the jump handle movement. All right, so see you guys in the next tutorial, and bye for now.